1 in every 8 women will develop breast cancer during their lifetime. It is one of the highest lifetime risks among all cancers. This risk increases with age dramatically. 95% of breast cancer develop after 40. That's why age is considered the strongest risk factor. If breast cancer is caught in the first stage, it has an excellent prognosis, while when diagnosed at stage 4, survival drops dramatically and it's very difficult to treat. That's why we will talk about the top 10 risk factors which increase the risk of breast cancer, how to minimize these risks, and what to do to detect it as early as possible if it still develops. The first and one of the most important risk factors for breast cancer is having a family history of breast cancer, because it increases the risk of mutations like BRCA1 and BRCA2 genes. If a person has these mutations, the lifetime breast cancer risk becomes up to 80%. This means the woman has a very high probability of developing breast cancer. These genes normally repair DNA damage, and when they don't work properly, damaged breast cells accumulate faster and turn malignant earlier in life. Even without genetical testing, there are clues that a person may carry high-risk mutations, such as several close relatives with breast cancer, especially if they were diagnosed before 50, or having a relative with both breast and ovarian cancer. The main solution is genetical counseling and testing, because once mutation is identified, screening becomes more aggressive and starts earlier. Annual magnetic resonance imaging is recommended from age 25 to 30, combined with early mammography. Some women choose preventive medications such as tamoxifen, which reduce risk of breast cancer around 40%, while others prefer preventive surgery in very high-risk cases. Every decision is personal, but early knowledge gives the strongest protection. The second risk factor is dense breast tissue, because dense tissue contains more glands and connective fibers, and these are more hormonally active than fat. That's why women with dense breasts have up to 5 times higher risk of breast cancer compared to women with fatty breasts. Dense tissue also reduces mammogram sensitivity, because breast cancer can blend into dense tissue, allowing tumors to remain hidden density. By touching, it cannot be felt, and even doctors cannot determine density by exam alone. It is a ratio of glandular and connective tissue to fat, and is measured by imaging tests. A mammogram report showing B1 RATS category C or D, it means the breast is dense. The solution is to add supplemental screening, especially ultrasound or magnetic resonance imaging. The third important risk factor is a long-term hormonal exposure, which can increase breast cancer risk by around 30%, depending on age, duration, and overall health. This means the more menstrual cycles a woman has, the higher her lifetime hormonal exposure. If menstruation starts before 12, menopause happens after 55, and the woman never had a pregnancy or had her first pregnancy after 30, this is considered high estrogen exposure. Even without hormonal tests, simply life history gives clear clue. Early periods, late menopause, and late pregnancy reflects lifetime estrogen. Fourth important risk factor is obesity, especially after menopause, because after menopause, fat becomes main source of estrogen. Other hormones are converted into estrogen inside fat cells, inside fat tissue, which raises breast cancer risk up to 40%. even moderate overweight raises risk. A body mass index 27 increases breast cancer risk by around 10%. The main solution is weight loss and physical activity. Losing 5 to 7 kilos significantly lowers estrogen levels and improves metabolic health. Daily walking lowers estrogen by 15 to 20% and is one of the strongest natural protective mechanisms. And the fifth important risk factor is alcohol intake, because alcohol increases estrogen production in the liver. Even 1 drink per day raises breast cancer risk 7 to 10%. And the risk rises with dose. Alcohol also damages DNA repair inside breast cells, allowing mutations to accumulate faster. The solution is very clear: reducing alcohol to 0 or 1 drink per week. It lowers lifetime breast cancer risk, especially after age 40. For women with family history or dense breasts, complete avoidance gives the strongest benefit. The sixth important risk factor is smoking, because tobacco toxins damage DNA and weaken cell repair system. Smoking raises breast cancer risk by around 20%, and the risk is higher if smoking started before first pregnancy. The seventh important risk factor is lack of physical activity, because movement regulates estrogen, improves insulin sensitivity, and lowers inflammation. Physical inactive women have 20 to 30% higher breast cancer risk. The eighth important risk factor is night shift work and chronic poor sleep, because disruption of circadian rhythm lowers melatonin, which normally protects breast cells from DNA damage. Women who work night shifts for many years have around 20 to 25% higher breast cancer risk. And ninth important risk factor is radiation exposure to the chest during childhood and adolescence. Radiation damages DNA directly and raises the chance of mutated cells will become malignant in later years. Women who receive chest radiation for lymphoma or tuberculosis before age 20 have a significant higher lifetime risk of breast cancer. And the 10th important risk factor is hair dye, especially frequent use of dark permanent dyes, because they contain aromatic amines, parabens, and coal tar derivatives. These chemicals can penetrate the scalp and cause low-level DNA damage. Several large studies show that frequent use of permanent dark dyes is linked to 9 to 20% higher breast cancer risk, especially in women with family history or BRCA mutations. The solution is reduce exposure by less frequent dyeing, lighter colors, semi-permanent products, ammonia-free formulas, gloves, and proper ventilation of room. And 11th important risk factor is long-term medication use, hormonal medication, especially combined hormonal replacement therapy, and some cases long-term high-dose birth control pills after 40, combined hormonal therapy after menopause, increased breast cancer risk by 20 to 30% due to constant stimulation of breast tissue. And solution is using lowest effective dose, shortest duration, and non-hormonal alternatives if possible. And what is standard screening for breast cancer? How to detect it as early as possible when treatment gives almost 99% survival rate. The main method is mammogram, because it detects tumors years before symptoms appear. Even they are too small to feel, women at average risk should have mammogram every 1 to 2 years. starting from age 40, because 95% of breast cancers develop after this age, and early imaging saves life. Women with dense breast, family history, and genetic mutations need stronger screening, which includes ultrasound and magnetic resonance imaging, because these methods see through dense tissue better and detect cancers that mammogram miss.